Hello dear students, welcome to my educational YouTube channel. As usual, we will have our online course, and this is English for medical purpose. My name is Gregory Darwijayoko, and let's study. Every decision in medical condition is very important decision. Why? Because this decision will have effect not only in shorter term but also in longer term. For example, a patient came to the hospital. He had a very severe injuries. Why? Because he had injured from the knife. So a person stabbed him in his stomach, and then the patients feel very painful in the stomach and came to the doctor. If the doctor gives the pain relief, for example, narcotics, heroin for example, for the patient, it will give the patient a pain relief. But if the patient is not careful enough, he can be addicted to the heroin. So this is just a very short example, very simple example, that the decision must be precise. Due to our current situation, if you ask me, what about the decision of the treatment, the medication of COVID-19? Don't trust what everybody says. Trust the competent one. Not all doctors, not all physicians really understand what COVID-19 is. And not all copy-paste information from WhatsApp, from Instagram. They are the truth. It's not all informations are true. So just before you making decisions, please recheck and think about the shorter term consequence and longer term consequences. Hippocrates himself, the first physician, ever made an oath, and this oath actually will become your own oath when you graduate from your school, Polteka Mangunwijaya. He said that I will use my ability, I will use my judgment, I will use all that I have to heal the sick, but never with any intentional of wrongdoing, of injury, of making them to have the worst pain. Well, an ideal decision will be made if both of the parties have made a consent agreement. However, sometimes physicians must make decisions without prior consent due to an unforeseen medical problem, like case study 20. Case study 20. Acting without prior consent due to an unforeseen medical problem. When Mr. M, a 52-year-old male, was referred to Dr. C, he was in a very serious state. His symptoms included fever, headache, dry tongue, sinus infection, and general septic poisoning. Urinalysis indicated his urine was badly infected. He had stones in his bladder and large stone in his kidney. Dr. C operated on Mr. M in May, draining his bladder and removing the bladder stones. The patient was subsequently treated with injections, and his bladder condition improved. He continued to experience severe pain on his left side and had also developed a hernia. A second operation was performed to alleviate the patient's overall physical condition. Several months after the second operation, Mr. M gave his consent to have surgery to repair his hernia. So Mr. M gave his consent to repair his hernia. A day or two after the operation, Mr. M was informed by Dr. C that his testicle had also been removed during the surgery. Oh my dear God. So his testicle had been removed without Mr. M's consent. Okay, due to potential problems it might have caused. So the consideration of Dr. C was this testicle could be another problem to Mr. M's health. In response, Mr. M said he had not given his consent to the removal of his testicle and had never been informed that it might be necessary. 3 eminent surgeons supported the correctness of Dr. C's procedure. They stated that no surgeon could have anticipated the condition and that further surgery had been necessary. Therefore, the question is, should Dr. C have postponed the operation until Mr. M was able to give his consent? If I were Mr. M, or I believe every male in this world would have objection to be removed our testicle. Okay, so on the other hand, as a doctor, professional doctor, they have to take the direct actions due to the emergency situation. So these two conditions are real dilemma. However, the question is still, should Dr. C have postponed the operation until Mr. M was able to give his consent? Here are few but not all possible answers. Discuss them as well as other possible answers. Identify ethical issues and decide which answer applies to your most, giving your reasons. Is it no or is it yes? Is it no, since removal of the testicle was a necessary part of the operation to repair the hernia? The need to remove the testicle could not have reasonably been ascertained before any surgery was undertaken, and consent for further surgery was implied in Mr. M's request to repair the hernia. Or is it yes? Because Mr. M did not give his consent to the removal of his testicle. Under these circumstances, a testicle can be surgically removed only if, this is a testicle guys, only if the procedure is considered an emergency or life-saving procedure. If it does not constitute an emergency, the physician must postpone the procedure until the patient gives his consent. In this case, however, it must be assumed that the condition of the patient's testicle was not considered to be so serious as to immediately endanger the patient's life or health, and that there was reasonable opportunity to obtain the patient's consent for surgical removal of the testicle. Okay, dear students, well, I'm waiting for your answers and response on the comment below, and I would appreciate if you read the book well and read about the case study, especially the court decision and also the discussion related with acting without prior consent due to unforeseen medical problem in the book that I gave you. Okay, good luck.